last keynote session for today, after which we have an oral presentation and then we close. So I want to thank you for your patience thus far. Our speaker today is Dr. Mohammed Naveed. He's going to be conversing with us about the environmental impact of sterilization and sustainability in sterile processing. This cannot be overemphasized. We all know the grave damage that nosocomial infections and uncontrolled infection spread in health system have done to patients and health workers alike. When I was doing my internship, we lost 7 nurses and 2 doctors to Lassa fever when there was a Lassa fever outbreak in the state I was working. So Dr. Mohammed Naveed is going to tell us how to prevent such catastrophes in the future. Dr. Mohammed Naveed holds an MSc in Public Administration, and his certification includes CRCST, certificate in ER, and certificate in HL. He serves as Secretary and PRO of the Operating Room Global in Pakistan chapter, that's TORG+KFHR, and focuses on promoting sustainable practices in sterile processing while exploring the environmental impact of sterilization in healthcare settings. He's here to also help us save our lives as health workers as well as those of the patients. Please join me as I welcome Mohammed Naveed. Thank you. Chief, please, are you on the call?
Thank you so much. Good morning, good evening, and good afternoon, distinguished colleagues, ladies and gentlemen. It's really an honor for me to be here in the online session. Today, we'll discuss about the crossroads, healthcare and environmental responsibility, the environmental impact, sterilization and sustainability in sterile processing. So sterilization is, without any question, one of the most critical pillars of patient safety. Every instrument that passes through the sterile processing departments plays a direct role in preventing infection and the saving lives. Yet behind the life-saving process life, another story lies. One of the high energy consumption, large volume of water use, single-use packing and chemical wastage also, the different so many things we have to consider that once. As we reflect on this, I would like to consider a simple question: how can we continue to safeguard our patients while also safeguarding the patients that sustain us? Today I will walk you through the challenges posed by sterilization practices, the environmental cost often hidden from the plain straight, and the most importantly, the innovative strategies and sustainable solutions that are emerging worldwide. Together, we will explore how healthcare can embrace the practices and not only the protect patients, but also preserve the environment for the future generation. So let's begin the journey of balancing patient safety and the environmental responsibilities. Uh, I will want to start the WHO, World Health Organization course. There is no health without a healthy environment. This is especially true when we look at the sterilization in healthcare. So as you know, everyone is know about the sterile processing. What is the sterilization? At least sterile processing departments are producing a sterile medical reusable medical devices, and they are responsible to provide the OR infection, prevent the infection. And the sterile processing is a critical process in healthcare, ensuring medical equipment is thoroughly clean, disinfected to eliminate the harmful microbes that safeguarding the patient safety. So it is very important for the departments to produce the safe medical devices for the patient. It's a fundamental role for the sterilization department. CSSD department. What is the importance in our healthcare facility? Basically, it's the behind the scene is doing the minimizing the infection risk. Effective the sterilization process is crucial is minimizing the infection risk in hospital and healthcare settings by ensuring that all medical instruments are properly cleaned, sterilized, and maintained. Healthcare providers can significantly enhance the patient safety, reduce the healthcare associated infection, and improve the overall treatment outcomes. The sterile processing is integral components, but there is a significant role. I already told you about this one, the minimizing the infection risk. But here we will discuss about the other thing also. We will discuss about what is the main impact on the environment for while we are using in the sterile processing and we are doing the reprocess of the medical devices. We will discuss here what is the things matters or doing the effects on the our environment in the healthcare. So first, understanding sustainability in sterile processing. Concept of sustainability. Sustainability encompasses the balance of economic growth, environmental care, and the social equity to ensure a better future. So it is very important thing to understand the sustainability in the sterile processing. We have to know about the what is the balancing our purchasing and different so many things we are doing. We are purchasing the lots of things like consumables, and we are using the water and so many things like energy we are using in our sterile processing. And the social equity also is sustainability play a major role in the sustainability. Conservation of resources. So in the sterile processing, sustainability is the sterile processing prioritize the conservation of the natural resources to minimize the environmental impact. Like that, we are discussing here about our energy resources. We are discussing about here our budgeting. We can discuss about here the minimizing the water usage also. So another things we have to consider this one innovative approach in sterile processing aims reduce the pollution through the eco-friendly materials and efficient practices. So this is the point we are going to talk about this one about there is a concept of green CSSD Center Sterilization Services Department or other thing you can say that the green sterile processing department. Ecosystem resilience. Promoting the resilience in ecosystem through the sustainable sterile processing practice ensure the long-term health of the environment. Actually, we are here so many big department, CSSD departments. They are making for the medical devices, sterile making medical devices. But the most important things, there is a continuously consistency to regulate the department. So first of all, we will discuss here about the energy consumptions. So in the backward areas or some different countries, you can see they are using the, the old sterilizer in their departments. So there is a lot of issues when they are using this uh, energy when they are using the sterilizers. So first things we have to preserve our energy consumptions. So in this scenario, if we are using the older sterilizer, so that's the main issue. They consume the more energy. So now in the modern days, there are so many companies they are making the energy consumptions less in energy consumption sterilizer they are making. So if we are going to this one energy consumption matters, we will see. So in this scenario, if we'll buy the new one, this one that's showing and that's claims the energy consumptions sterilizer. So there is a two effect if effects on this one if we are purchasing this one. First one is our budget is going too low. And the second one, sorry, the second one is when we are buying the sterilizer, so long term, we will save our energy consumptions. The second thing is when we are purchasing the new sterilizer, new modern areas, the new technology are launching already, so we can save also our water. Behind the water usage, there are so many things are going on. Like we are making the RO waters for the sterilizers and for the washers also, and there are also wastage of so many waters if we are using the old one machines. So that's also another issue if we are using the old one. So water usage and the wastage also is going to increase. If we are converting to our modern technology, so can save the water and the energy also, and also ultimately we can save our time. The statistics of the sterilization, waste, and recycling process. Current statistics are showing this one. 65% of total waste generated from the sterilization process is recyclable, significantly reducing the environment impact and the landfill usage. So, if we are going to and we are convert into our modern technology, we can save our 65% wastage generated. So, here you can see the sterile sustainable practice in sterile processing. Sustainable is sterile processing emphasize eco-friendly practices that minimize the environmental harm while maintaining the efficient sterilization procedures by implementing the recycling program and reducing energy and water consumption. Healthcare facilities can contribute together for the planet without compromising on patient safety. So first, our responsibility and the first uh, priority is the patient safety. Without compromising the patient safety, we can convert uh, our department into the modern technologies. The other thing, there is so many challenges if we are using the traditional sterilization method. There are so they are increasing our pollutions. There are so too much wastage, uh, as well as consumable wastage like that. Another thing, uh, energy wastage, water wastage, uh, so many things. If we are using the traditional sterilization methods. So first of all, what is the process? How can we do the implement these strategies? First, initial assessment. So we have to do the first initial assessment of our sterile processing department. What is going on, and what is the wastage, and what is the point we can improve these things. So first we will do the assessment, like we have to calculate our energies, how much energy kilowatts we are using for the in our sterile processing departments, and how many water usage in a day or every machine, how many water consumptions, and other things, what we are doing the practices, how many wastes are generated when we are doing the reprocess of medical devices. So after the assessment, we have to implement the recycling program. Establish recycling initiatives for packing materials and the other recycle waste generated during the sterilization process. So we have to do the some typical critical points, and we have to do the some practices if they are using the like sometimes in the sterile processing is noting their duplications packing like that. Uh, Sometime if they are not supplying on the OR, they are doing the double packaging. Double packaging is not mandatory for the other clinics. So only for the we have to convert the policy. If we are doing these practices, we are always providing the double packaging, double for the instruments. So it's not mandatory for the clinics. It's mandatory for the OR when we are, because we are going to do there only for the aseptic techniques. This is a mandatory for the OR items. So other things like uh, we have to, there is a recycling programs, and we'll do if the not duplication the consumables, and also we have to look after the what is the going, some sterilizer also are saving water saving capacity they are doing us in this scenario. Like in the modern technology, they are giving us for the some special sterilizer. They are providing a recycle of the water. They are built in for the means water coolant in water cooler inside the sterilizer. They are using the water while they are doing the vacuum phase. So it's an important thing while we are purchasing the that things. You have to understand what is giving us most and favorable for the sterilizer, and what is the recycle options for the water or not. Here we have to upgrade our equipments like energy. We have to understand what is the going to energy saving, preserve our energy, and the water usage, and the operation efficiency. So here's the word operation efficiency. So enhance operation efficiency, we have to understand what we are machines we are using in our sterile department. If we are using the uh, difference between the, I want to understand about the difference between the machines. So if we are using the plasma sterilizer, and the other thing is ETO sterilizer. So while we are talking about the cycle timing, is ETO ultimately is going to 4.5 hours to complete the one cycle. But the other hand, when we are using the plasma, so we can use the process time is ultimately it will take around about 50 minutes. So 4.5 hours one side, the other side, if we are upgrade the equipments, the only for the 50 minutes is complete our cycle time. So it we can this things this if we are adopting these strategies, we can also preserve our energy, our water, even we can get the if we have the shortage of instrument, we can get easily and the fast time quickly the equipments of the sterilization process. So the other thing is staff training. Staff training is must, should be must, because sometime is mostly 40 to 50% the staff is going to duplication of the instruments due to some droppage of the instrument in the sterile area or whatever where they are using, and when they are going to reprocess the equipments, sometime they are also doing the double packaging, and sometimes the staff don't know about this one, they are going to reprocess 2 times 3 times duplication means. So we have to understand, and we have to do the staff training in this perspectives if we are going to sustainability in the sterile processing. So the after this one, staff training, upgrade the machines, and the assessment, each and everything we have to monitor and evaluate the sterile processing techniques practices, regularly review and assess the effectiveness of recycling and waste reduction strategies, ensure the continuously improvement. If we will monitor and evaluate the all of these things, sorry, we can easily understand what is the holes where we have to find out the practices or strategies we have to make, and we have to evaluate the things. Is monitoring and evaluation is mandatory after the adopting the modern practices and strategies as after staff training. So in this slides, you can see we have to do the energy efficient. So we have to purchase the energy efficient equipment. So while we are purchasing the equipment, we have to understand sterile processing is an ongoing process, and while the hospital is there, every time you need for the sterile instruments, so you have to purchase that equipment. If sometime the first budgeting maybe is going to increase, but over the time we can see the equipment budgets for the maintenance budgets, it will coming down while you are uh, approaching the energy efficiency equipments. So other thing is water conservation practices. As I told you in the back slide, water conservation practices is most important thing. It's not about the only for the water usage. It's about the what things are going in the behind the scene, like water consumption, no doubt, and usage, and the other thing is also energy consumptions. It's also involved the water conservation practices. Water conservation practices help them minimize water usage during the sterilization cycles, which is crucial in preserving the vital resources. Implementing the system that recycle water and the water advanced sterilization method that requires less water can enhance the sustainability and reduce the environmental impact. So in this one, you can see if we are using the water conservation practices we are using, so we are not uh, save the water. The other hand, we are save the energy and as well as sustainable reduce the environmental impact also, because they are not going to water use wastage. So here instrument containers for the packing material also impact the sterile processing and the environmental impact. Like that, there are so many options while we are going to practices and while we are going to packaging the sterile area for the packing of the instruments. So first, most of the hospital they are purchasing the consumable things, like they are purchasing the sheets, they are purchasing the papers, pouches, like that. But the important things if we are converted to containers, there is a one and most important things, we have to reduce our disposable items. The choice between the containers and wrapping sheets affect the resources consumptions, with containers offering a more sustainable long-term solution by minimizing the landfill contributions. So if we are using the containers for the packing of the instruments, we can minimize the landfill contribution. Is directly impact the environmental, and the other thing also we are going to reduce our cost of the CSSD cost or still processing department cost. We can reduce the things. So here in this slide, there is a difference between the ETO sterilizer effectiveness with the environmental concern. There is the other picture in show the plasma sterilizer eco-friendly efficiency. So ETO sterilizer are widely used for their effectiveness in sterile heat-sensitive medical devices. However, the environmental impact includes the significant emissions for harmful gases which can contribute to air pollution, require the careful handling and monitoring. The ETO sterilization also consume the considerable amount of time, resources, making it less efficiency in high demand settings. The other thing, uh, in the equivalency, we can convert into the, if we are going to convert into plasma sterilizer, we can save our time, our energy, and it's also going to eco-friendly efficiency. So it's an important thing while we are practicing our sterile processing department, we have to understand what's going to eco-friendly efficiency environment. We are going to green CSSD. There is a concept for the green CSSDs. There is a case study which conduct in a Green Med Hospital sustainable practices. So first they did Green Med Hospital initiated a sustainability program focusing on energy efficient sterilizer to enhance their sterile processing operations. So they did upgrade their equipments to the energy efficient sterilizer for the to the older one. So they did get the better results while they are using. They did change the environment. The 2021 they did also study. The hospital reported a significant reduction in waste, successfully diverting approximately 65% of sterilization waste landfill through the enhanced recycling efforts. So in this scenario, they did they did prioritize they are using for the packing material, like they did use the containers instead of our consumable sheets or uh, gastro reels, like the reels pouches, something else. So they did convert into container to reusable consumable material to containers. So 65% they did see the result, the reduction in the wastage and the landfill through the enhanced recycling efforts. So it is an important thing what we are going to do, and how can we do, what's the impact of our environmental. So in 2022, GreenMed received the recognition of its commitment to environmental responsibility, showcasing the benefits of integrating the sustainability in sterile processing. So in this scenario, as I told you before, it's not first priority is our patient safety. So prioritizing the patient safety involves ensuring that all medical instruments are sterilized effectively to prevent the infection and maintain the high standard of care. Also, the second thing is environmental responsibility. These both things that we have to do the same time. Then we can achieve our goals for the CSSD, green CSSD. Balancing this with environmental responsibility means adopting practices that minimize the waste resources consumptions, such as using the eco-friendly sterilization method and recyclable materials. So one thing more I want to discuss here. There are some hospital on the daily basis they have a less inventory for the instruments. They are using the fast track reprocessing them. They are requesting for the fast track the instruments for the specific set, because the OR and the hospital don't have inventory or less inventory. That's why they are requesting the sterile processing department. So it is a more important thing while you are doing the fast track or priority instruments, then sometime the cycle is ongoing, washer and the sterilizer is ongoing only for the one sets. So it is important thing in the month when we are going to calculate in a month or in a year, so we can purchase easily our 10 sets. If we have a shortage, we can while in the end of the year we are energy consumption, we did energy consumptions and the wastage for our resources. While we are calculate all of these things, we can easily purchase the more than 10 sets. So we have to understand if we are sometime on the initially basis we are saving our budget, but the ongoing we are lose our department or budgeting in this scenario. So sterile processing is crucial for ensuring the medical devices is clean and safe, directly impacting the patient health. So we are not going to compromise anything, but we are also we can see the impact of the sterilization department on the environment. Important of sustainability is sterile purchasing minimize processing minimize the environmental impact while maintaining the patient safety through the responsible practices. We are not going to compromise anything. We are not going to compromise patient safety. We are not going to compromise the patient health. Future direction is continued efforts to innovate in eco-friendly sterilization method will be vital for the healthcare industry futures. So there is a today for the session for me. So if you have any concern, any question, uh, you can please ask me.
Thank you so very much, Dr. Navid Mohammed. It's a pleasure to have listened to you. Um, Many health workers usually underestimate how important it is to sanitize and sterilize equipment until cross infections occur in the hospital. And the problem with nosocomial infections is they also come with some form of resistance, and it forms a lot of problems in caring for themselves as well as the patient. It also limits the surgical outcomes in a lot of cases, especially sterilizing surgical equipment. Um, so I would like to give the audience an opportunity to ask two questions because we're out of time. Then we'll forge ahead. So, but if you're in the audience, please two questions, and you could type your questions into the chat box, and I'll read it out. Okay, someone is asking if you are going to please give the slides that you just presented. I think you ought to have sent that to TORG.
Okay, sure, we'll see. Sure.
Okay. Okay. You can type your questions in the chat box, please.
I think chat box there is a question.
There's no one in the chat box for now.
Yeah.
Okay, but prior to now, I have a question myself. Prior to now, we had had Professor Rodolfo make a presentation on robotic surgery. And I think there was a question that was bubbling in my mind. How do we ensure
Yeah.
sterility for the robots when they start robotic surgery? Is that a future perspective that you think can be looked forward to? Sterility for the robots in robotic surgery and the equipment also used in robotic surgery. Is that something that you can please speak on over the next 1 minute before we move to the next session, please?
Thank you for your question. It's a very important question regarding the moderns. We are doing the modern techniques in our equipments. So most important things while we are talking about the robotic instruments, there is a specific cleaning process, and there is a specific we need the tool to clean and disinfect the instruments. And according to the MSDS, everything is mentioned is there, but as per the IFU instruction for you, you have to read about these things. There is so many complexity while we are doing the reprocess of robotic instruments. So usually while we are using the while we are reprocess the robotic instruments, we can usually method we are using in our CSS department sterilization process we are doing here for the robotic instruments, but we are doing the special tools for the cleaning and disinfection. So we have to figure out what we have to need the specific tools for the cleaning perspective. So there's a if The better outcomes if you are more curious about the things about robotic instruments. They are the complex instruments, I know, but it's better if we are going to do the with the chemical indicators and